Were you overweight like me and my hubby, then decided to get weight loss surgery? You know, you look at these before and after pictures and it makes it look so easy. But if your experience has been anything like me and my hubby's, it's not. There is a lot of hard struggles along the way. Surgery, contrary to what a lot of people say, is not the easy way out. I'd like to invite you to come to a free webinar where I'll be talking about some of the things I've learned through the trial and error of both me and my husband after having weight loss surgery, and where we had our successes and where we had our failures. So it's not a weight loss plan, it's not a diet plan, it's not what you should do. It's simply a bunch of ideas, kind of like offered up like a buffet, to help you overcome some of the struggles that you're having after having weight loss surgery. I go deep into a few of the most common struggles, such as getting enough water or getting that 60 to 80 grams of protein, which sometimes can be pretty tough. All you have to do is click to register for the free webinar. On desktops, the link is in the lower left, and on mobile, it's on the upper right. I had Roux-en-Y surgery back in 2010, and everything went pretty well. Both me and my husband had it at the same time, actually 7 days apart. And we were both 100 pounds overweight, and he was a type 2 diabetic, and I had joint pain, ankle pain, and so we decided to do it together. My name is Zena Awesome, and I still struggle daily with getting enough fluids and protein. As I said, my gastric bypass was in 2010, but 2 years after my surgery, I ended up in the emergency room in excruciating pain, and it ended up that my intestines had gotten tangled, and it actually started dying. 3 surgeries later, and after they put me in a coma for about 9 days, I recovered enough to go home. And even though I was eating 3,000 calories a day, all the food was just passing straight through me. And after 5 months, I got down to 95 pounds, and that's when they decided they had to put me on IV nutrition. Now, don't get IV nutrition confused with a feeding tube. Feeding tube still goes into your digestive tract. IV nutrition is where they actually put nutritious fluid, right into your vein. And I was on that for 11 months, giving my digestive system a chance to rest and learn how to digest again. And even after I was taken off the IV nutrition, I still had challenges like not being able to digest iron. So for about 4 years, I had to have iron infusions regularly. Fortunately now I don't have to have iron infusions. Your digestive system is adaptive, and a lot of times it'll learn how to do things given time. So if I can make it through all this, I know you all can too, and I want to share a lot of the things I've learned along the way. Unfortunately, last year on February 2nd, 2020, my husband, soulmate, best friend, business partner passed away. But if he hadn't had the weight loss surgery and been at a healthy weight when he was diagnosed with his cancer, I would have had a lot less years with him. So I'm really thankful that we both had the surgery and that I got to spend more time with him. So I will still be talking about some of his struggles and some of the things we did, because we were married 31 years, so he was a big part of my life. And you can learn from some of the things that he liked, because, we're, obviously not the same people. So he liked some things I didn't like. It's like he was the chocoholic. So we always had to make sure he had chocolate in his, whatever he was doing. So please click the link, register for my free webinar, and Thank you for watching, and I hope to see you soon.